This topic is avoidant personality disorder. This is a cluster C personality disorder. The diagnostic criteria includes avoidance of social situations and relationships stem from an intense fear of criticism and rejection. The symptoms begin in early adulthood, and their symptoms present in a variety of environments. That's really important to remember. You can see these symptoms at work, at school, at home, or in other social situations. This causes impairment or distress for the client. That means it affects every part of the client's life. This is similar to social anxiety disorder. But let's talk about that for a second. Social anxiety disorder is an anxiety disorder. It is the fear of saying or doing something, and that could lead to shame or embarrassment. They worry over fear of scrutiny, and it's specific to certain things, like speaking in public. Whereas avoidant personality disorder is a personality disorder. These clients have negative self-evaluation in comparison to others. They have feelings of personal inadequacy. In social settings, these clients fear rejection and criticism. They have limited intimate relationships, and in those relationships, they need a lot of reassurance and unconditional acceptance. They avoid interpersonal contact. They want that companionship, but their fear is too great, so they don't establish interpersonal contact. These clients have low self-esteem. This is linked to their difficulty functioning in social settings. It's also linked to their feelings of inferiority when they compare themselves to others. They are reluctant to try new things because of their fear of rejection of new people. All of this may lead to depression, anxiety, and anger because they cannot develop relationships. Treatment for these clients is similar to social anxiety disorder treatments. The client may be prescribed SSRIs and SNRIs. These help with mood and feelings of anxiety by increasing levels of serotonin and norepinephrine in the brain. These can especially help reduce social anxiety. Beta-adrenergic blockers can also be prescribed. These help with the physiological symptoms of anxiety. They help reduce the autonomic nervous system hyperactivity, like decreasing heart rate. Behavioral therapies for this client will include cognitive behavioral therapy. This type of therapy will help them identify what causes anxiety and then also plan interventions the next time they are faced with that. They will also have social skills training. These exercises will help them enhance new social skills. But be careful, because any sort of failure can increase their feelings of poor self-worth. They will also have assertiveness training. This will help the client express their feelings and their needs. It will also teach the client how to say no to set boundaries. They will learn effective communication techniques so that they can handle any sort of confrontation when they do start to set boundaries. Nurses will want to have a friendly and reassuring approach with these clients. We do not want to pressure them into social situations. Pushing them to do something that they are not ready to do can cause severe anxiety for these clients. And we as nurses want to convey an attitude of acceptance for their fears. These fears are very real for these clients.